Melissa Martinez with the Plaza County Health Department again, and it is Friday, so you know what that means. It means it's Fit Friday, and we're talking everything fitness today. So today, guys, I have the blessing of sitting down with Dr. Black here at the Waynesville Medical Plaza, and we're going to be talking about how to be proactive with your health. I know a lot of people right now are making all kinds of changes, you know, with their New Year's resolutions and trying to get fit, but one thing that we kind of overlook is our health, and we really want you guys to focus on that, because if we can prevent a lot of these ailments that hit us as we age, it's much easier to prevent than it is to treat. Am I right?
That's correct.
So thank you so much for taking the time to sit down with us. Would you please introduce yourself and tell our viewers what you do here?
Well, I'm Dr. Paul Black. I'm a family practice physician, and I'm the director of the rural health community, or the rural health facility here at the Waynesville Medical Plaza.
That's awesome. Now, you just moved here, correct?
I did.
And you like it here?
I love it. We were looking for a wholesome place to raise our children. We have a 4-year-old and a 6-year-old boy.
Wow, that's you are so blessed. You come to the right place, because this area is amazing. It's got a lot of wonderful things to do and wonderful people. So welcome, and we're glad you're here.
Yeah, I'm glad to be here.
So let's get started then. So I kind of looked up about being proactive with health, and the way they kind of defined it was acting in anticipation of future problems, needs, or changes. Would you agree with that?
That's correct.
Okay. So some of the ways that I look at as an athlete, and we talked about this earlier, as someone who is now 50 and has to live life a little bit differently. I have to really watch, you know, what I do with my body. So some of the ways I found, and I want to get your take on this, one thing that we can start doing right now is getting plenty of water.
Absolutely. I don't advocate the use of sodas at all, and I think I'm okay with people using a little bit of coffee, but if you're drinking coffee all day long, that's not good for you. If you're drinking tea or sweet tea all day long, that's not good for you. It tends to generally dehydrate you. You need water. Water, water, water.
Yeah, and I love that you said that, because we actually talked a little bit earlier, and I know a lot of people are, you know, especially if your palate is used to a lot of sugar, it could be hard to go straight to water. So if they wanted to baby step it and kind of get themselves to where they enjoyed water again, to make it a little sweet, you said that a little stevia.
Stevia,
would
yes,
be okay.
It's a plant-based product, and it gives a sense of sweetness to your tongue, and it is not, in my opinion, dangerous in any way, shape, or form. There's some research that suggests some of the other artificial sweeteners may not be healthy.
So would that be a good idea for someone that says, I don't like water, to say, okay, I understand that. Why don't you try stepping down little by little?
Well, they may want to try to squeeze a half of a lemon in some water, and then add a little bit of stevia to sweeten it up, and that may be better for them. If they're truly can't, just so used to drinking sodas, you know, that might be a step down.
Yeah, that's great. So you're kind of making a lemonade that's healthy.
Kind of, yeah. But yeah, it would be healthy.
So how much water would a person need to drink? Is there a guideline they go by?
There's no real guideline. 8 glasses a day is probably a little much for most people, but probably 4 would be 4 or 8 ounce glasses would be a minimum, and 6 depending on your activity level, or depending on the weather. Middle of the summer, you're going to need more. Just kind of pay attention to your body. If you feel thirsty, you've gone past the point of dehydration. So you should never feel thirsty.
So would, if you're dehydrated, that causes a lot of bad things. Would that cause like headaches?
Yeah, that can cause headaches, constipation, and a multitude of some other serious health issues. Heart palpitations, et cetera, et cetera.
Wow.
Electrolyte imbalance, all kinds of things. So, you know, if you just think back, anytime anybody's ever gone into the emergency room, what's the first thing we do?
That's true.
We start fluids on them almost all the time.
That's true. Do you think a lot of people are walking around dehydrated and just not even aware of it?
My professional guesstimation would be probably at least 80% of the people are dehydrated.
Wow.
And don't realize it.
Wow, so this is definitely a great way to be proactive.
Water is one of the most important nutrients you could supply your body.
I love that, and it's the easiest to find.
It's easiest to find, but well, here, of course, in the Ozarks, we have an abundant supply of good, clean water.
Yes.
It comes out of the ground. We're blessed with that. Other places, it's not always that
Yeah.
that healthy.
Yeah.
So, we're a little. Your own brand of bottled water is your choice. I lean towards something that would be a little more alkaline in general because our diets tend to be more acidic in general.
Okay. So I'm glad that you said that. That'll get into our next one of a healthy diet. So if you could give a couple tips for someone who says, what's a healthy diet? What are some easy ways I can start on that?
Oh, it's very simple. Of course, cut out refined foods.
Which is anything packaged?
Yeah, if somebody else put it together besides your mom, it's probably not healthy. And even maybe suspect some of the things your mom put together because they may be comfort foods, you know?
Sure.
If it comes through your car window, it's not healthy.
Yes.
Yeah, just plain and simple. We won't get into details there. But if it comes through the car window, it's probably not healthy.
It's probably got a lot of sodium, a lot of sugar, a lot of preservatives, and even if it's on the healthy menu.
Even if it's on the healthy menu. If it's a national chain, it probably lacks a lot of nutrient-dense food. If you could go to the farmer's market on a regular basis and get your food, that would be fine. But I don't know of any national chain or any drive-through or any kind of restaurant that does that. There may be one around here, I don't know. I'm new to the area. The other thing I recommend, of course, stay away from sugars. Raw refined sugar is just, it's calories without any nutritional value. It's pure calories. The other thing is I recommend to my patients stay away from some bleached white bread.
Yes.
And some people really do well if they just stay away from grains completely. It tends to be a bit of a genetic factor for many people, but if they just avoid all grains, that's wheat, barley, rye, rice, oats, and even corn, just stay away from those foods. Just don't touch them, and use all your other vegetables and fruits and meats and healthy choices as opposed to those. And a lot of people find if they do that and they're fairly strict with it, for 6 or 8 weeks they start noticing changes, like they lose weight, their cholesterol comes down, their blood pressure comes down, they sleep better, they feel better. Things tend to start normalizing. And so I recommend some of my patients do a trial of that for 6 weeks and see how you feel. You may not have a serious disease process, but your body may be intolerant to some of those foods.
Would you recommend, I love that you said that too, would you recommend that they might keep a food journal as well so they can kind of track?
Right. And sometimes the symptoms don't show up that same day.
Yeah.
Sometimes you don't eat something and immediately feel bad or headache or bloated or whatever you might feel. Sometimes it may be 2 or 3 days out, so you may have to do just a little just look back a few days and say, okay, well, I feel like crap today, and why is that? Well, we'll go back. Well, look, I ate this on Monday, and then you may see a trend happening a few times every time you eat that food, and so that would give you an indication that your body maybe doesn't like that food. Mine may have no issues with it. Could be as simple as pineapple. You may have a mild intolerance to pineapple. I find in general the grains, there tends to be more people intolerant to the grains. I'm not sure the reason. I have my theories, but I'm not sure the reasons. So
that's interesting.
We start there, and most grains are refined, and so they're simple carbohydrates, and your body converts them pretty quickly to sugars. So my general advice, if you give a blanket advice, is to try to avoid the grains that we talked about, and then keeping your food journal to see what foods you've gone through, and then maybe if you want to follow your weight too, you can see, whether your weight's gone up or down, whether you're retaining water or whatever. So
basically, it would be safe to say as well, try to stick to things that appear like they just come out of the ground.
Well, yeah, that's the healthiest, but also your body is different than mine. We all have certain food sensitivities or intolerances, or even some people have food allergies. So, and some people have different nutritional requirements, and it's really hard to know exactly what that is. That's why the Food Journal, and maybe watching your weight on a regular basis makes a difference. Because if your weight's gone up, that means your body's retaining water. Usually, you can't gain it's hard to gain 3 pounds of fat overnight. So usually, and that would be, maybe you had something with a lot of salt in it.
Yeah.
Or it would be that there's some inflammation going on. And why is the inflammation? And the inflammation would be from a mild allergic reaction of sorts in your gut tube or your GI.
Wow. Yeah. Wow. There's a lot to that. So let's move on to the next one then. How about reduced stress? How important is that in our health?
One of the reasons, one of the reasons I decided to come here was for that very purpose. My employer stresses a balance.
Yeah.
It's a very calm area in general. And the people are just regular old people.
Yeah, yeah, we're laid back. We're really laid back. We're very laid back.
Friendly. No real agendas going on.
Yeah.
I mean, that was my objective. And so, if you're under constant state of stress, your body's going to break down very quickly.
Yeah.
It is.
Yeah. Yeah. Oh yeah.
Much.
Yeah. I agree with that.
Your nervous system will get frazzled, and it'll leave permanent scars.
Yeah.
And some of the things you'll never recover from. You'll pay for it later in life. You'll pay for it.
Yeah, I would have to agree with that. I would agree with that, which actually that brings us up to one of our next things we're talking about, which is one of the greatest stress reducer, one of the best that you can ever do besides alleviating the situation, which is not always possible, is exercise.
It is a very good stress reducer, but there are other things. It's an excellent stress reducer. And some people find that competitive sports, like basketball, league basketball or softball, they love, that's a stress reducer. To me, watching television is a stress inducer, not a reducer.
Yes.
So I gave up the TV 25 years ago. I don't watch the TV.
I don't watch TV either.
Occasionally, I may sit down and watch about 3 or 4 minutes of a college football game or something, but that's about it. Okay, my father-in-law has a TV in his room, and I might kind of stick my head in and see what the score is on the national championship game or something. But I don't watch TV. We don't really have we have a television for the children that has some children's channel, but we don't, as a habit, we don't sit down and watch TV as a family. There's no TV room, there's no TV in the family room, whatever. So that's a stressor. Organized sports can be a de-stressor. Regular, if you want to exercise by yourself, whether it's a light jogging or bicycling or swimming or whatever your choice is, it's good. Also, any hobby that you enjoy. Fly fishing can be de-stressing.
That makes sense.
We live in an area with some very good trout streams, or very good streams that are filled with trout around here. Whatever hobby that you truly enjoy. And at the point where you start to get frustrated with it, it's time to either step back and reassess or stop doing it.
Yeah, that makes a lot of sense.
But if you enjoy it, then that's what you should pursue. We all have different interests. You maybe run.
Right.
Well, running is not something that interests me. I might be more interested in league basketball or something like that.
So basically, people need to find what they like.
They need to find what is important to them, what works for them. It is all, once again, like the food choices, it's individualized. We're all different.
Sure.
Every one of us are made up of, we're all humans.
Yeah.
We're all related at some level, but we're all different. We have different makeup psychologically, mentally, physically.
So as maybe you can put this into everybody, and I agree with you that everybody's different, and that's what makes this great.
That's what makes the world
it makes the world
fun to live in.
But at a minimum, how many, generally speaking, how many minutes of exercise should a person shoot for a day? Sustained amount of the exercise for their health.
Interesting that you said that. There is some research that say 4 minutes of burst strenuous exercise is actually enough.
Like high intensity training, heart rate up, let it go down?
Day.
Okay. Oh, wow.
Yeah,
okay.
Is enough. That's more recent research. The general consensus is 20 minutes 3 times a week, 3 or 4 times a week was enough of getting your heart rate up to 75% of its maximum. There's a way to.
Right.
You take 220, subtract your age, multiply that by 75%. And that's your maximum heart rate.
Okay.
So if you're 40, you take 220 minus 40 is 180, times that by 75%, and that gives you your maximum heart rate. So that's been sort of the advice for years and years and years. But we're finding now that just 4 minutes of high intensity training can really make a difference.
Wow. And everybody's got that to spare, don't they?
Yeah.
Or we should make
time. It has to be high intensity. It's not 4 minutes of walking up a half a flight of stairs.
So high intensity would be on the level where it would be almost impossible to talk to someone and hold a conversation?
Yeah, not quite that high intensity, but yeah, it would be difficult to carry on a conversation, yeah.
Okay, so that puts it...
We're not talking about pro athlete kind of stuff.
Yeah.
Okay, remember you're a regular athlete, and maybe some of our listeners are just starting out. So I don't want people hurting themselves by trying to do too much too soon. But yeah, 4 minutes of high intensity where your heart rate gets up there in the 75% range, whatever it is.
Well, I'm glad that you brought that up. Let's talk about something else before they start an exercise program, especially for someone like you just said that maybe has taken a break from it or hasn't exercised their whole life and says, okay, I want to do it. This year's the year 2021, I'm going to start. Should they come in and get an annual screening? I mean, how often should we be doing those?
Well, if you're 50, you probably need annual screenings. At age 50, you need a few things done once a year. And that's my favorite part of practice, is to pat people on the back and say, good job, see you next year.
Nice. Yeah.
That's what I like to do. Just do an annual screening and make sure and answer a few questions, make sure everything's good, all right. Yes, they should do an annual screening. If they've had other health issues in the past, or they have current health issues like high blood pressure or heart disease or diabetes or even problems with their spine or their knees or whatever, and they want to start an exercise program, I think it would be a good idea to talk to us and see, or talk to their physician, whoever their physician is, and see what might be the best exercise program.
Yeah.
There are some people I do not recommend they go out and start running because they've already got bad knees and they're going to just tear down their knees further.
Right.
They may be better off doing an elliptical or a bicycle or something else.
That makes a lot of sense. And that's something that they can go in and discuss with their doctor, like you said, based on their individual needs.
And once again, individualized medicine.
Yeah, I like that. And that's what you guys do here at Phelps
That's
Health.
what I
it's
do.
Very individualized.
Yes, that's what I do.
I like that. So speaking of individuals, should a person, is how important it is for people to know their numbers? Now we're talking, you just said the blood pressure, cholesterol, vitamin D levels, iron levels, the blood sugar. How important is that? Should people be really aware of that?
I think, yes, I do. I really do think so. All the ones you mentioned. Mm-hmm. The iron is not as important unless you're showing signs of anemia or whatnot. But your blood pressure is very important. It's called the silent killer. People can have blood pressure through the roof and have kidney failure or heart attack and never know they've had it.
Really?
Yes.
Wow.
And even younger people it can happen to. I mean, it's remarkable. So you should have your blood pressure checked. And if you get it checked 3 or 4 times and it's above 140 over 85, perhaps you should keep a log and bring it in to your physician and have him check it and talk to you and find out if there's some intervention that needs to be done.
Okay.
My preference is, let's start with lifestyle and diet and stress reduction.
Yes.
The things we talked about first.
I agree with that. Love
we'll give
that.
you 6 weeks or 8 weeks,
Mm-hmm.
or maybe sometimes 12, depending on the number. You keep a reading, bring it back in, bring your machine. We'll calibrate your machine with ours, and we'll see where you are. And if you're still up, then I'm kind of forced to treat it. Now, if you're smoking and your cholesterol's through the roof and your blood pressure's through the roof and you're a diabetic and you're not willing to exercise, then I still have to practice medicine. I have to do what's right by you. I have to give you the medicines. I'd prefer to not give you the medicines. I'd prefer to give you the lifestyle.
Right.
And you follow the lifestyle. But, I'm a licensed physician, so I will do the medicine if we have to.
So what would you, I love what you just said, because my takeaway on that when I'm listening to you is like when somebody comes in, it's like sometimes they don't have the knowledge to know what they're supposed to do. And so you can sit down and say, Mr. Smith, your blood pressure is such and such, your cholesterol is this, what I want you to do, and then you can tell them this is the healthy diet, this is how you exercise. Well, that alone, that probably could eliminate a lot of need for going on medicine. Is that true? Sometimes
probably 60% of the time.
Wow, 60%. That's
probably,
amazing.
If they would listen.
Uh-huh.
Mm-hmm.
And it's always.
But some things are genetic. Some things are sort of built in, and some things are maybe they're in a stressful situation they can't get out of it. Their job. We all have to provide for ourselves.
Sure.
But but it's individual. Everybody's different. It might be that you need to just meditate for 5 minutes. It might be that she needs to get 10 minutes of exercise a day that she's not getting. It might be that this person just needs to turn off their TV or put the phone down. Please.
Yeah.
Put the phone down, please.
That's a lot of stress, isn't it? That it can be.
Yeah. Sometimes you see people driving down the road. That's dangerous. It's against the law in some states.
Yes, I agree with you there, and I think that can be a stressor in itself too, especially when you're inundated all the time with negative news, or just your mind's always engaged and it never disengages.
Or when it's ringing. When a person calls you, that is a request for your attention. It's not a demand.
So we don't have to pick up the phone.
You don't have to answer it. Unless it's your mom or your kids.
Right.
You don't have to answer it.
I love that you said that, because I think sometimes we spread ourselves too thin and we forget that we're in control of our time.
That's right.
Yeah, and the more we
What did we do before we had cell phones?
We played outside.
Yeah.
We talked on the landline, but not very long because he wanted to sit there.
Yeah.
Right? That wasn't much fun. But yeah, I agree with that.
Or we went over and visited the people.
We did.
Oh my gosh,
we did.
Imagine that before the days of COVID, we actually visited each other.
That's true. That's very true, and I hope that we get back to that one day. I'm kind of ready. Yeah, soon.
That's a stress reducer.
That is a stress reducer. I'm glad that.
Just to know your neighbor and talk to your neighbor about, I don't know, the Kansas City Chiefs or whether or not what day they pick up who knows, that's a stress reliever.
Yes, I would agree with you there. I'm very glad that you said that. So we look forward to that day. Hopefully, that's one thing we could talk about too, is that the vaccination has come out.
It's come out, and hopefully Phelps will have some available for the public really soon. I don't have the official word on it. I'd have to get with my office manager, but it's not going to be long till we have it available for the public.
Yeah, and you guys can keep checking with Phelps Health and also with the Plaza County Health Department on that, because it's definitely coming down the pipeline. So there's hope on the horizon. But I got one more question for you, because this is kind of something I've had people ask at the health department too. So screenings, you talked about a family history. What kind of screenings should people get? And when a family history plays a part of, what kind of screenings? I'm 50. What screenings do I need?
I would probably just do some blood works, just a complete blood count, which is your white cells, red cells. A chemistry, which tells me your sodium, potassium, how your kidneys function, your liver. I might do cholesterol, fasting cholesterol, see if your cholesterol's up or down, and a few other minor things in there that is really kind of only important to doctors,
Yeah.
Then if you're 50, you really should have a screening colonoscopy. Colon cancer is probably the third largest killer in America.
Wow.
Still.
So it probably.
But if you're, let's say, a close relative, first degree relative, or your sister, your mom, your dad, somebody in the family had colon cancer, you take the age at which they were diagnosed and subtract 10 years. So if your dad had colon cancer at 56, then you subtract 10 years from that, you should have your screening at 46.
That makes a lot of sense. Okay. So I'm going to end it with this because I think this is super important. I think you talked about the individual, but to treat the individual, you really need to know the individual. So the sooner someone comes in and establishes a relationship with a primary physician, I would say that, to me, I would think that their care throughout their lifetime, because most doctors practice a long time, is going to be better because they've established that relationship. They can freely talk, and the doctor says, "Oh, let me look at your chart. I've got your numbers from your last visit." How important is that?
Well, I think medicine is returning to where the primary care is the hub of the wheel, where the internal medicine doctor, the family practice doctor, and those who actually do primary care, those other specialists who've gone back into primary care, that's the hub of the wheel. And that it's vitally important. Seeing a specialist and neglecting your primary care doctor is really a mistake.
Yeah.
You need your specialist if you have lung issues that they need to take care of, or if you have other issues that they need to take care of. But you still need to come back home because that's the person who really knows you.
Right.
The specialist is looking at the lungs. The other specialist is looking at, the heart doctor is looking just at the heart. It's the primary care doctor is looking at the big picture and saying, okay, you're on this medicine, you're on this medicine, you're on... By the way, are you sleeping okay?
I love
Doc,
that.
I haven't slept. Or does your wife say you snore a lot and you're like, maybe this is why your heart and your lungs... So the primary care doctor is the one who steps back and takes the sort of the global look.
Yeah.
Some people call him a generalist, but we actually see the big picture of your whole health. The whole health picture.
I love that you said that.
That's what we do. That's why we do the screenings once a year. That's why we want to do that. We want to see, you're putting on, honey, you're putting on a little weight. You want to keep an eye on that, or good job on the weight loss, or how's the exercise? How's the wife? How's the kids?
Love that.
And have you found any good trout fishing spots recently? Or whatever.
Yeah.
I
love that. So there you go. We're going to end on that, guys. I think the important takeaway from all of this is to be proactive with your health. And I think it begins with taking some of these steps, but it also begins with getting a general practitioner, someone getting your own. So then you can establish the relationship. And it's you're never too young to start that, and you're probably never too old to take charge of your health.
Absolutely. And it's your health.
Right.
And it's your responsibility. It's my job to advise you on it.
I love that. Thank you so much for your insight, and thank you for taking the time to sit down and talk to us. Guys, that has been another edition of our Fit Friday. Thank you so much for viewing, and thank you again. We hope to have you back again.
Thank you very much.
Thank you. Bye, guys. Thanks.